Hi guys, welcome to Nes Kelvin TV.
Please like, comment, share, and subscribe.
Hello, student nurses. Have you ever felt stress writing the nursing care plan? Most especially the nursing orders, the nursing intervention, then the evaluation. Okay, if you've ever felt stress writing this, then please stick and stay with me and let's learn together. In this episode, we are going to learn about how to write a proper nursing order, proper nursing intervention, then the evaluation. Okay, before we start all this, we need to understand nursing diagnose, which I've already shot a video on it. You can check my YouTube channel. It's there. How to use Nanda to write the nursing diagnose. But let's do a quick recap. Do you know that whatever that we are going to write, which is the nursing order, the nursing intervention, then the evaluation, we are going to use the nursing diagnose to write all these things. You see, the nursing diagnose, and the master of all these names we are ever being now. So it's one of the important things on the nursing care plan. So when we talk of the nursing diagnosis now, it's a clinical judgment of how a patient or a clinical judgment of a patient responds to a health condition, as I've already told you guys. So now, as I've already let you know, sir, the nursing diagnosis now is based on the actual, the nursing orders, the nursing intervention, and the evaluation. Let me give you a nursing diagnosis. And the nursing diagnosis, the acute pain related to inflammation as evidenced by patient reporting pain score of 8/10. And the way a nursing diagnosis. We are going to base on this nursing diagnosis and the nursing orders, the intervention, then the evaluation. So now, what is nursing order? So when we talk of the nursing orders, they are instructions, they are actions that address the nursing diagnosis. Fancy blueprint, and your blueprint, so what they address the nursing diagnosis. And you see, this nursing diagnosis, because nursing diagnosis, we have the PES method. So nursing diagnosis, you be what problem we have the P, then we have what is causing the pain. Pain, are they causing it? The etiology, which is what the cause. So then evidence now a patient, pain and I trust a pain score of what of 10, a pain score of what of 8 out of what 10. But also what I say, okay. And now we never be busy on what is what the acute pain related to inflammation, as evidenced by patient reporting pain score of what of 8/10 or out of 10. So I never be busy on to write the nursing diagnosis, and to write what the nursing intervention, the orders, and the evaluation. The nursing orders and their instructions, their actions are about addressing the nursing diagnosis. And the nursing diagnosis, and nursing orders being and will be pain, will be pain more than pain at Yako. And I say, pain, or we are going to reduce the pain. Those are the things your friend in the nursing orders. But most of the times, we students, we miss the nursing orders with the nursing intervention. The simple thing that you need to do is the nursing orders are talking about what you need to do, what you're supposed to do for the patient. So then the nursing intervention is talking about how you're going to do those things now. You see, my patient, how do you do it? And the patient, yes, pains, what are you going to do for the patient? Okay, drop it under the comment section. And you say, acute pain. And the nursing orders will be what? Nursing orders, so the nursing orders, and then the nursing orders will be what? So the nursing orders is going to be one. We can give what? Prescribed analgesics. So nursing order will tell you that give what? Prescribed analgesics. Reposition patient every 2 hours. Position patient every 2 hours. So then you better teach the patient relaxation technique daily, and I said twice daily. And also, these are also something to help manage the patient pain, because in managing of patient pain, we have what the drugs which is pharmacological method. Then we have what a non-pharmacological method. So some of the non-pharmacological method, we have what relaxation technique. So then the nursing orders will also tell you to check the vital signs. So until now, you have 4 things, and these acute pain related to inflammation. Now you have the nursing orders needing a German. That's how we get the nursing orders. Abuja, I hope you are getting to understand what I'm trying to teach you. Okay, so now you have a nursing orders. You need to what? First one, we need to give us a prescribed analgesics, which is a man every pain medication here. A man or the prescribed, so give the prescribed analgesics. The doctor will tell you to give the prescribed analgesics, such as reposition the patient every 2 hours. So, and I'm saying, we need to also teach the patient relaxation technique. Twice daily. Then check the vital signs, because the patient is going to experience a whole lot of things. One, the heart rate between the apostrophe, such as the patient can experience diaphoresis, which is severe sweating. So the patient can go through a whole lot of things. So when you check the vital signs, it will let you know whether there's been improvement in the pain and answer still now the so these are the things I heard the nursing orders. So what I say. So now let's go to the nursing interventions. So the nursing intervention here then direct. So the nursing orders and the nursing intervention they are going to address. Okay, so guys, now let's move to the nursing interventions. So now we have, this is what the nursing orders. So nursing orders, yesterday administer prescribed analgesic, reposition patient every 2 hours. So then teach the patient relaxation technique. So teach the patient relaxation technique. Teach the patient relaxation technique. Then yes, also I catch you then teach the patient relaxation technique twice daily. Then yes, check the vital signs. So now we are going to break all these things now down into the nursing intervention. That's what I say. So your nursing intervention should link directly to the nursing orders, then the nursing diagnose. Okay, so how you know your cancer then? Administer prescribed analgesics. So when we are writing the nursing intervention, the nursing intervention will be like said, prescribed analgesics were administered into bracket paracetamol. So as a side effect and allergies were monitored. I was just watching us here. You just say, when you are changing, you say prescribed analgesics, you say administer prescribed analgesics. So when you are writing the nursing intervention, this is how we are going to change it to. So it will be like saying prescribed analgesics were administered. So as into bracket paracetamol. To one example, me also then man prescribe analgesic into bracket paracetamol. Na the man nipa. So as you monitor say the allergies any side effect of the medication were monitored. It prescribed analgesics were monitored. Prescribed analgesics were administered. So as into bracket paracetamol. Then side effects and allergies were monitored. That one the nursing intervention. Then hereby I say reposition patient every 2 hours. And also how are you going to do it? So patient was repositioned. So the patient was repositioned into bracket supine to lateral to left lateral. So supine to left lateral. Into one man we say ampa position when the patient so then skin integrity was monitored. Into monitor the skin integrity. So any pressure source and as a I hope then you teach the patient relaxation technique twice daily. So when you are changing it to the nursing intervention, you write it like this: such as a patient, such as a relaxation technique were taught. Such as a so patient what were so patient I bet me I can say relaxation what technique were taught. The taught what relaxation technique were taught twice daily. So relaxation technique were taught twice daily. Patient participated. So patient participate here. So relaxation technique, relaxation technique were taught. So into bracket, deep breathing exercise. So patient relaxation technique were taught into bracket, deep breathing exercise. So then the patient participate here. This is what the nursing intervention. Then we have check the vital signs. So and I know say most of us we know. So the vital signs were checked and recorded. The vital signs were checked and recorded into bracket. The BP no be a BP near then 120/80. So the BP were 120/80. Then other abnormalities were reported. Let's move to the evaluation. So when we talk of the evaluation now, what is the evaluation? So the evaluation is going to measure the nursing orders, the nursing intervention, what I say a work here. So they are going to measure and see whether that the nursing intervention, any the nursing orders now where they and I say what I say we are my patient, they did work a year juma. So and you won't say you do one map, you do nursing what orders in nursing, you want to do that evaluation one of my better will be interested in go fully met. Abusia on treasuring that place in the what's you go fully met. So go fully met. What are the things? What are the evidence? I actually go and achieve. So that place in what we have to go fully met. Then we have to go partially. Straight then. But when the student do one man what go fully met, no we wrong. So now yaka say a year then yes ya reposition patient ya administer the prescribed analgesics then my patient aside then also ya say then the teaching patient relaxation technique or participating ya checking the vital signs ya vital signs normal so any normal so niema we na ye ma patient na or acute pain no so niema we na ye ma a worky a year juma, a patient, and on a nursing evaluation here then. So Obi do go fully met. So do you say go fully met to one of my betting attributes then go fully met as evidence by. So that place you give evidence. So go fully met as evidence by patient. So reporting that pain has reduced from 8/10 now we can train to maybe 3/10. So after receiving and I say after repositioning and also the afterward repositioning and also afterward taking in what the analgesics. I hope say Charlie what you say. Go fully met. You bet me at sir. When I bet me and say go fully met as evidence by and I say go fully met as what patient so as patient what reporting and as verbalizing that pain has what reduced. Short as after maybe the repositioning and after the relaxation technique. These are you know near man short as and that place so when we are done writing maybe we go fully met do you know say you need to put your initials there. This is where we make mistakes. Do you know say you need to put initials? You need to make sure so drop your initials there. So me, my name is Amo J. Kelvin. So after you have written what go fully met, So that after you have written that goal fully met, as evidenced by patient verbalizing that pain has reduced, such as from maybe 8/10 to 3/10, such as after after the relaxation or the administration of the analgesics, such as you can write what maybe the emoji curve intimate me then A K. Now I tell them student nurse. So what you say, then you sign a signature.
Hi guys, welcome to Nes Kelvin TV.
Please like, comment, share, and subscribe. Clap.